You know,
Hey,
you
hi,
guys
I'm
got a
Joe.
bunch. Sorry, I'm out of here.
No, that's fine. Hi, I'm Joe Play here with Dr. Huncho, Red Styles, Rampage Jackson, and we have Dr. Tempura and Dr. Stitch maybe also supervising to conduct Kassidy's interview. Kassidy, can you please throw up all your macros for me so we can see you have them in the video? All right. That's good. That's all of them. So now I'm gonna go ahead and read some of the rules, the HPMD and some of the RP rules. You can stop me any point if you have any questions or concerns about any of them. All right.
Okay.
Okay, here are the HP rules. Do not resuscitate players on any street or any street surrounding the hospital or the army base or any of the gang territories, which are the blue territories that have the blue border around them. Do not serve patients who have their weapons drawn. Do not stand or sell on the main lobby floor. Do not go AFK while on duty. It's a 3-day ban demotion. All funds returned. Only 2 staff members may be at each desk in rank order, which is brown, maroon, blue, white, and then green. And up to 3 may line up down the hallway, also in rank order. If your medication restock wait time is over 5 minutes, you should go on emergency calls or med deliveries. If it's under 5 minutes, you can wait in the cafeteria. Do not use the front door. When you rank 6 or higher, you can use the front door. Rank 7 or higher, you can use the front parking lot. Do not ever spawn the bus. Once you're like white, scrub, or blue, you'll have the ability to, but do not ever spawn that bus. Radio checks are mandatory, and you cannot attend the gang territories, without a rank 7 or higher present. Do you have any questions on any of those rules?
No.
All right, I'm going to go ahead and read the MD rules. MD1, refusal to provide medicine or resuscitate civilians or any person without a justified RP reason, provided there's no threat to your life, like a shootout. Punishment is 1 rep. MD2 is use of firearms by medical staff is strictly prohibited. Punishment is dismissal. MD3, medical faction members must follow all established project rules. Punishment is either 1 rep or 1 warning. MD4, personal use of official medical vehicles is prohibited. Punishment is 1 warning. MD5, issuing medical certificates outside the hospital setting is forbidden. Punishment 1 warning. That includes like doing medical stuff while on vacation. MD6, medical actions during dangerous situations like selling pills or resuscitating people during life-threatening situations. Punishment is 1 warning. MD7, gang association and criminal activity like theft, vandalism, or murder, or affiliating with other factions during events is prohibited. Punishment is dismissal. So that includes you can't ride with any gang members, can't hang around them. Yeah, can't hang out by their 1v1s when they have 1v1 shootouts. You can't be their personal medic. Yeah. MD8, disrespectful behavior or conduct toward any individual is prohibited. Punishment is 1 rep or dismissal based on the faction leadership's decision. MD9, failing to follow orders or observe rank-based subordination. Punishment is 1 reprimand. MD10, using personal vehicles for EMS tasks is not allowed. Punishment is 1 warning. MD11, medical personnel must role-play their duties appropriately, like interactions and announcing assistance and checking your surroundings during emergencies. MD12, improper use of tasers, attacking civilians with a taser weapon or any physical force without RP reason. Punishment is dismissal. Do you have any questions on those rules?
No.
All right, just a few more of the RP rules. RP 13, non-RP behavior within game factions, including unlawful release of prisoners or execution of civilians by the police. Punishment is exoneration from the faction and or from 30 minutes in one state jail to a 3-day ban. RP 14, any form of non-consensual sexual actions, including simulation and explicit dialogue or actions, use of ethnic and or LGBT plus slurs or excessive attention. All sexual actions require OOC consent. Such actions should not occur in public or frequently visited areas. Punishment is a 60-minute mute or 24 hours up to a 30-day ban. RP 15, intentionally provoking faction members for entertainment or disrupting faction operations is prohibited. Punishment 30 minutes in jail. RP 16, any criminal acts toward emergency medical personnel are prohibited. Punishment is 90 minutes in months in jail to a 12-hour ban. Do you have any questions on any of the rules?
No.
All right, I'm going to ask you a couple questions. Most of them, there's no right or wrong answer. So just answer according to what you think. All right. Why did you want to join the medical faction?
I like helping people and making sure that they have what they need.
All right, that's a good answer. What do you think are the most important qualities that a medical professional should have?
I think you should be trustworthy, honest, and having willing to change, like being able to change how you are.
All right, that's good. Um, what would you do if you witnessed a faction member breaking a rule?
I would make sure that I had my body camera on, of course, and then I would go report it to somebody higher up.
That's exactly the right, correct. Um, what would you do if you got an emergency call and you arrived on the scene and there's a gang member, a police officer, a medic, and a civilian lying there? Who are you gonna pick up first?
The medic. That way they would be able to help me with the other people.
All right, that's a good answer, but the correct answer for this one is whoever has the red circle around him, whoever placed the call, because that's what your priority is. He's your patient, and then after, if it's safe to do so, you could pick up whoever else is there.
Okay.
What are the three places that you're never allowed to pick anybody up?
Outside of the hospitals, outside of the armies, and like around the blue strips where the gang members are.
Yep, that is correct. Um, how do you keep your coworkers motivated?
Just by encouraging them and letting them know that they can come to you if they need anything.
That's sweet. That's good. What would you how would you handle a high stress situation? Let's say you're downstairs, a bunch of gang members pointing their guns at you and people screaming at you for medkits and pills. How would you handle that?
First, I would call somebody higher up in the hospital to come see if they could help me. And then if that doesn't work, then I would call the PD.
And like, how would you handle yourself? Make sure you don't go like from all the stress.
I would make sure I would try to calm everybody down first and then try to get whoever's first. And then if that doesn't work, then I would ask them to, of course, put their guns away and then leave the hospital.
All right, that's true. And what you were saying before about PD, yes, you can ask a higher up to call PD. I think you have to be rank 6. I'm a rank 5, so I can't even do that. But I think you have to be a rank 6 to call PD. Um, but yes, you can definitely and make sure your body cam is rolling. If anything, you need a report over there.
Okay.
Yeah. How would you role play a medical emergency?
Sorry, what do you mean by that question?
Like, let's say you respond to an emergency call. How do you role play? How do you role play it out?
Whenever I first got there, I would check the scene and make sure that everything is safe and that there is no danger to my life. And then I would go to the patient. I would make sure that I put my macros out. And then I would administer the first aid kit. And then I would say that I did that with the macro. And then I would leave and then go on about my day with the next call.
All right, that's correct. Does anyone else want to ask any questions?
Um, what is the punishment for showing your gun while on duty?
You'll be dismissed.
Yeah.
All right. If no one else has anyone else have any questions?
So one of my main questions, you already used that one. I'm trying to remember the trick question that I had. Oh, okay, I got it. All right. If me and you was at a turf, just us two, and I was taken down, what would be the proper procedure for resuscitating?
I would make sure that there's like no gunfire or anything, and then I would do all my macros, and then I would give you the first aid kit. I don't know. My other answer would be that I would have to leave because I wouldn't have a higher level with me anymore.
Okay, boom, correct. So we cannot be at turfs without a rank 7 or above with us. Second, we are not allowed to resuscitate no one at the turf. We can't resuscitate no one at the army. We can't resuscitate no one on the 4 blocks that the hospital sit in the middle of.
Okay, that makes sense.
Yep. So if no one else has anything, that concludes your interview. Great job. You should I'll post these within a few hours, and the meeting tomorrow at 5 p.m. Eastern time, you should have your rank up. If you're there, there's like